A very warm welcome to all the healthcare leaders and the diverse audience joining us today for this webinar. I'm Nikita Kathuria, representing the Secretariat of the Health and Environment Leadership Platform by PHFI and Healthcare Without Harm team. And it's really our pleasure to see such a dedicated group coming together to discuss a pivotal shift in the industry, building a robust ESG program within the hospital ecosystem. So, as we strive forward for the climate smart healthcare, moving beyond the traditional models toward integrated ESG frameworks, it's now not an option, and it's really a necessity, becoming a necessity. So, to lead us through this complex and diverse, vital discussion amongst this, it's my absolute honor to introduce our moderator for the session, Dr. Sunil Khetarpal, sir. So he's a healthcare management professional with over 37 years of experience in the hospital administration, quality accreditation, policy advocacy, and digital health. He's also the state lead of Haryana for the health platform, and he's also serving currently as the Deputy Director General at the Association of Healthcare Providers India, AHPI. As a healthcare leader and public health advocate, he actively contributes to healthcare policy, quality improvement, and capacity building across the India. So the mic and the stage is all yours, sir. I would like to request you to kindly take on the webinar further. Thank you so much.
Thank you, Nikita, for the kind words of introduction. So, good evening, everyone. It is my pleasure to welcome all of you today to today's webinar on building an ESG sustainability program in the hospital. This important session is being organized jointly by the Public Health Foundation of India and the Healthcare Environment Leadership Platform, the India chapter of the Global Healthcare Without Harm initiative. So I would also like to acknowledge the leadership of Dr. Alexander Thomas for driving the initiative at India as chair of HELP platform, and Dr. Shweta Prabhakar as the lead North region for bringing together this important dialogue. So healthcare institutions exist to protect and improve human health. Yet it is increasingly recognized that the healthcare sector itself has a significant environmental footprint, from energy consumption and water use to biomedical waste and supply chains. Hospitals are highly resource-intensive organizations. And globally, the healthcare sector contributes a notable share of carbon emissions, which makes it imperative for us to rethink how healthcare is delivered in a sustainable manner. So that is where the concept of ESG, that is the environmental, social, and governance, becomes highly relevant in hospitals. The environmental dimension focuses on reducing our ecological footprint through the energy efficiency, sustainable infrastructure, responsible waste management, and climate conscious operations. The social dimension of ESG reflects our core mission, ensuring patient safety, staff well-being, and equitable access to care. And the governance dimension ensures that the sustainability is not treated as an isolated initiative, but becomes embedded in hospital leadership, policies, accountability structures, and the long-term strategy. So in many ways, hospitals are uniquely positioned to lead this transformation. And as trusted institutions within the society, hospitals can influence not only healthcare delivery, but also broader conversations around climate resilience, public health, and sustainable development. So through the platforms such as HELP, healthcare institutions across the world are committing to reduce the environmental footprint while promoting healthier communities. So today's session, we will focus on how hospitals can move from intent to action, how they can design and implement practical ESG sustainability programs that create measurable impact. So we are privileged to have with us Mr. Karan Thakur. Dr. Karan Thakur is the National Engagement Lead at HELP, and he is also the Group Vice President, Corporate Affairs and Sustainability for the Apollo Hospitals Group. He is a very seasoned healthcare administrator with wide experience in the field of health policy, hospital operations, projects, healthcare communications, and healthcare sustainability and ESG. And he is a 2022 Global Fellow from the from India for the Eisenhower Shower Fellowships. So in 2024, he was awarded the prestigious Chevening Gurukul Fellowship for Leadership and Excellence at the University of Oxford. Now, I also warmly welcome all the participants joining us today, the hospital administrators. We have a various diverse group of people who are joining this webinar, the hospital administrators, policy makers, clinicians, and sustainability professionals. So your engagement in conversations like this is essential for building a greater and healthier healthcare ecosystem. Now, I'll hand over to Dr. Karan Thakur for sharing his valuable insights on the topic. Over to Dr. Karan, please.
Thank you. Thank you, Sunil sir. Thank you, Nikita, Dr. Shweta. Thank you also for really coordinating and organizing this webinar. You have been the force behind this, and thank you for your leadership on this. Thank you for the very warm and generous words. And thank you also for laying out the context of why we need to discuss this subject. Often, sustainability and ESG are used as interchangeable terms, while sustainability is a very broad term that encompasses lots of aspects, including financial sustainability. But ESG is a performance metric approach towards sustainability measurement. So just like sustainability are principles and things that we want to work towards, ESG then helps us really drill it down to what it looks like when we measure the progress that we are going to make on our sustainability commitment. So what I intend to do over the next 45 odd minutes is to have a discussion around how you can build a program around ESG if your hospital is just starting up, to look at sustainability and ESG reporting in a big way. If you are already reporting on ESG parameters, how you can strengthen it through the use of standard metrics that are globally accepted. And if you're in the advanced stage, what other fine tuning can be done as you mature your program towards sustainable practices and ESG reporting. I will then leave the last bit of 10 minutes or so for your questions answers. Please feel free to ask as many questions as you would like on this subject. Since this subject is new for many of you, please don't hesitate to ask on aspects that you may not have fully comprehended in my conversation here. And also, because of paucity of time, I may move very quickly through some areas where you may not be very familiar with. So please feel free to bring them up at the end of the webinar, when we'll have about 10-15 minutes. So thank you once again for this opportunity. Let's look at how we can really build a credible ESG program, that looks at sustainable practices. We will then look at what are some of the reporting frameworks that are out there that hospitals can use. And these are from global frameworks, just like we have quality frameworks, whether it is NABH, whether it is ASQA, ISQA, JCI, and so on. There are similar reporting frameworks within the ESG paradigm. After that, I'll discuss, the GDP model, which I have coined towards what a good ESG program should look like, the main components. And this is not the financial GDP of a country, but the GDP of an ESG model within your hospital. And also dwell a bit about one aspect which is not spoken about when we talk about ESG and sustainability, which is IT and cybersecurity, which is very much part of ESG, but not really discussed because the climate conversation and the social conversation dominates the conversation around ESG, but nonetheless, as we become more digitized, this is becoming increasingly important. And then discuss some of the ESG parameters that you could probably start looking at within your hospital. As Sunil sir already mentioned, ESG really stands for criteria around environment, social, and governance issues. And as you would notice, these are non-financial factors, very different from sustainability of the financial kind, where we are looking at viability. This is beyond those, this is non-financial. Um, and some of them are clinical, but this is not core clinical also. So it is non-financial and non-core clinical criteria that we look at. But having said that, patient is at the center of any good ESG program also. And then this looks at really creating long-term value along the ESG pillars. And environment would include things like emissions, energy, and waste. Social would look at community engagement, staff welfare, and patient impacts. And governance looks at how hospitals are run, what is the accountability, what are the controls that the mechanisms that are there to ensure good delivery of care is managed, and the organization is run in an ethical and sustainable manner. And when we do these things, they are very important for us even in hospitals. This is not just for any other organization, because we want to reduce risks, whether they are risks to patients, whether it's risks to staff, or it is risk to our infrastructure and resources that we have. And then also improve resilience. If you have a good ESG program, you will be resilient towards various shocks. Currently, the world is going through a geopolitical shock, which is causing mayhem across financial markets, the oil markets, supply chains, and so on. How do we make sure that we have reduced that factor or risk when we follow ESG practices, good governance practices, and build good social practices? We can offset some of the challenges that come from these various shocks and risks that are out there and ensure sustainability. If we look at where sustainability really emerged from, this has close to about a 3 decade origin. Close to the mid 1990s, there was an understanding that organizations cannot just be run for shareholders. We need to also look at stakeholders, because shareholder value maximization only leads to profit maximization and looking at profit as the only reason to exist. Whereas by the mid 1990s, there was an understanding that we need to evolve towards a stakeholder approach, where the interests of a wide stakeholder community are taken care of as an organization evolves into maturity. Then in the early 2000s, we had the evolution of the socially responsible investing, where there was a lot of activism when people were putting money into organizations or to buy shares to see whether this organization is socially conscious or not. And you would see that in the early 2000s, there were only about 10 or so indexes which were looking at social activism. So those were the early days of ESG's evolution. Then a pivotal sort of moment came in 2006, when the United Nations actually recognized the importance of reporting, and they came out with the principles of responsible investment, which looks at, if an organization, an investment organization, a bank wants to lend, how do we make sure that we lend to organizations that are conscious about social issues, environmental issues, and about governance also? And here we see that in 5, 6 years, the number of index, meaning the number of such firms that are looking at PRI framework, went up to about 25. So we have a wider adoption of the PRIs. And then we see in the 2010s, investors and regulators also coming into it. In India, SEBI became a very active player as a regulator to ask for companies to report on BRR, which was the business responsibility and reporting framework, where organizations were supposed to report on how well you are managing the social dimension, the environmental dimension. And then we see in the 2020s, this really becoming much more evolved towards ESG frameworks. There are frameworks to evaluate ESG performance. There is benchmarking that is available. And then there are ratings agencies which will give ESG scores to all organizations. And then more so, it became very specific for healthcare as well. And increasingly, we find more and more organizations following ESG parameters. Mind you, ESG previously was being followed by organizations that are listed on stock markets. But now we find with regulators becoming highly evolved, ESG principles being part of any sort of reporting framework, whether you look at JCI today, whether you look at NABH or others, all have a aspect of sustainability and ESG well built into their assessment criteria when they are looking at accreditation cycles as well. So this is not just about companies, but this is also now becoming embedded into quality and outcomes. So why should we do ESG? Well, it has benefits across the three pillars. We know that it helps in reducing our carbon footprint, which is both good for the planet, but also accrues financial savings by reducing the amount of consumption that we have. It helps in reducing the amount of resources that we use and consume, and we know that they are increasingly becoming challenged. And then also helps us to build regulatory compliance. On the social dimension, it actually helps in patient and staff satisfaction. Staff are wanting to work in an environment where they are taken care of, where their health and their other needs are also taken into account. And any organization that has a good ESG program will need to have a very strong S program, which looks at how we evolve towards a more staff-centric, patient-centric type of approach. And also looking at supporting community health initiatives. This can be in areas proximate to the hospital where you operate. How do we engage with the community to make sure that we are not only in the curative side of healthcare, but also in the preventive and promotive side of healthcare? That helps to create and foster wider trust between the community and healthcare organizations. And with a good social program, we can make sure that nobody is left on the margins. We include everybody in society to work in hospitals, to have access to hospitals, and to make sure that we are more equitable. And along with this comes governance, which helps reduce risks and enhance transparency. And like I said, not only become more competitive, but also be more resilient. Now, when we look at what are the type of risks that I spoke about, there are multiple risks when you look at the healthcare environment. I spoke about geopolitical risks, which are more at the international or global level. But even within hospitals, when you look at the type of risks that exist, you can find them everywhere. If you have been part of any operations program or quality program, you would know that risk identification is a major part of any good administrator's job or responsibility. And here again, when we look at sustainability risks, these are quite common when you look at general hospital risks. There are operational impacts that we have when we look at sustainability in terms of risks. If you don't have a good ESG program, you will have high energy, water consumption, waste generation, which is not attuned to global best practices. And this will require interventions at all levels and continuous interventions. Not only that, if you don't have a good conservation or energy efficiency program, you will also be vulnerable because any supply chain disruption will impact you disproportionately. Secondly, there are regulatory risks that are involved. If you don't follow good ecological practices, environment level practices, water conservation practices, or staff welfare practices, you could be looked at through various regulatory lenses, and there could be fines imposed on you. There could be action that could be taken against you, or call for improvement that could be undertaken. Some organizations may also run the risk of getting their licenses jeopardized because of regulatory risks. This also helps build a good patient quality and outcomes program. And if you don't have an ESG program, you might even compromise on patient safety and quality. And we know that any good organization really exists and is credible when it has good outcomes on the patient side. Staff welfare, again, very important. We know that as we work towards our patients' well-being, but the staff are the real people who are really delivering on it. And if you don't really have a good, robust program for them that takes care of their rights, their well-being, and also creating a good working environment, you will have high attrition rates. You will have risks of employee action against management, so on and so forth. So there are multiple impacts that you could have on the employee side, on the staff side, if you don't manage that risk better. Now, typically, when we look at how ESG is then implemented, it follows, a sort of a PDCA type of thing that you would do in a good quality or operations program. Here again, the first and foremost need is to do an assessment of what are the current practices that you're actually employing within the hospital on sustainability. And I'll give you a list at the end of this presentation, but generically speaking, most hospitals are running some sort of waste segregation program because they need to be compliant. They must be running some sort of water or waste reduction program, as whether it is as a quality initiative or a 5S initiative, or any other improvement plan that they may have, or it could also be as part of some financial effectiveness that the hospital is trying to do to reduce the costs or reduce waste that is being generated during the hospital operation. So one is to first do an assessment: what are the few things that I'm already doing, and then what are the gaps in areas that I have not worked in. So you could say that I have really not done any work in water conservation. That becomes a starting point for you to start looking at what could be done within your hospital or your organization on an area that you've not touched upon. And then you could have targeted ESG initiatives that can be implemented on those. This would also then require that you monitor this with good data management and governance, which I'll touch upon right after this section. Because without good data, target setting can be faulty, progress can be patchy, and you will not really have any credibility. Because at the end of the day, if I say I have saved 25% water in my hospital last year with very poor data management, it's very difficult for anybody to believe what you're doing. And then once you have embarked on this monitoring, you will then build in some bits of road mapping so that you can improve your performance year on year. In fact, good organizations that have implemented, wide-ranging ESG programs have reported a 25% reduction in operational costs. This is across the board. So this 25% means that for every 100 rupees that you were previously spending, there is an opportunity to bring that down to actually 75 rupees by good operational practices. And many of them are not very capital intensive. They require just good coordination, leadership, data management, and then managing the outcomes and continuous improvement. Now, like any science-based, evidence-based programs, ESG also comes with standardized frameworks, and it's important that we follow the science when we want to improve upon our ESG performance. What are some of these? The most important of this, if you want to take one framework that you want to use for your hospital, is the GRI framework, or the Global Reporting Initiative. GRI is a global standard. It is not a healthcare specific standard. But that does not take away from the fact that GRI is widely recognized globally as the gold standard for reporting on ESG and on sustainability. So if you download the GRI guidelines, which are available for free on their website, you can then pick out what are some of the areas and metrics that I want to use for my ESG program to start reporting on. And this could be very simple, which could look at energy, water, waste, and then can go to very complex, metrics, which looks at the intensity of emissions per rupee of revenue and so on. So you could really start very simple with this and then move this up the order of maturity as your program develops year on year. And as I said, this covers the entire range of ESG performance, whether it is emissions, labor practices, governance, and so on and so forth. So a very good benchmark to use is GRI, and it can also help you really identify improvement opportunities. So one is that you look at your current performance, benchmark it, set some targets, and then look at where are the opportunities to grow. And a lot of people now are looking at GRI as a reporting framework. And I would strongly encourage you all to look at GRI as one major reporting framework that you want to look at. The other one is to look at the United Nations Sustainable Development Goals, the SDGs. These are goals that are set out for countries, and countries have to report on progress on their SDGs annually. India also does so and has made remarkable improvements on the 17 SDGs that are there. But within those broad 17 goals, three really are attuned towards healthcare and ESG. SDG 3 looks at good health and well-being. So it looks at core clinical outcomes, prevention, equitable access. Uh, Clean water and sanitation also has a major component that is related to health and hospitals. And then because of the focus on environment, climate action is SDG 13, which looks at decarbonization or reducing your carbon footprint. So you could align your ESG program to GRI and SDGs together and broadly work towards the goal of good health and well-being under SDG 3 and so on, while grounding your metrics on GRI. So again, this can be used in conjunction. It need not be used, one or the other. The third one that I want to spend some time on is IFRS, which is the International Financial Reporting Standards. And the IFRS sustainability standards are very focused on not just healthcare sustainability, but sustainability for any organization. And what they have done is there were multiple reporting standards that were out there, and it led to a lot of confusion about which ones to follow. So IFRS is the collection of all of those great minds who are working on standards making, and now we have one unified standard, the S1 and the S2, under the IFRS. And most organizations and most countries are now adopting the IFRS S1, S2 as a reporting standard. So you could look at GRI and you could look at SDGs. And as you mature, you could look at the IFRS. And this again has benefits and relevance for hospitals because it enhances credibility. It can help foster trust with regulators, especially, and then meets a global standard that you are looking to sort of work towards in terms of creating a program which is measurable against the best in the world. And again, this looks at risks and opportunities. It has a heavier financial angle to this, but again, related back to the core of sustainability. So again, something for you to use, but this would be the high end or the other end of the spectrum. If I was starting out on my program, I would first get myself very well versed with GRI, work on the SDGs, and then in time look at my IFRS reporting. And again, this is very new. The first, few companies that started and organizations that started reporting on IFRS was only in January of 2025, which was just about a year ago. And this is globally. So you won't find more than probably 100, 200 organizations in the world across all sectors that have reported on IFRS, whereas there are thousands, maybe the tens of thousands of companies that report on GRI standards. So again, that's more the standard of reporting. And then I now like to move towards creating that program that you have. You've looked at GRI, you've looked at SDGs, you are now also taking first steps towards S1, S2. How do we create this model? And there's one model which I propose, which is the GDP model. And like I said, this is not a GDP like for the country, but this GDP really looks at the acronym at governance, data, and programs and projects. These are the three important components for you when you are building a good program on sustainability for your organization or for your hospital or chains of hospital. Under governance, it helps to establish leadership accountability. Whether it is at the board level or it is at the hospital bedside level or at the ward level, how are we creating a governance structure which makes sure that the entirety of the organization has some aspect of sustainability built into their performance metrics? This is very important. Without good governance, without somebody being responsible for sustainability, and without sustainability being a part of the mandate for every level of the hierarchy in the organization, sustainability and ESG will just remain mantras but not become implemented facts on the ground. So whether you have a hospital board or you have a CEO or you have local level teams that are working at the grassroots level, each of them has to have some metrics that are influenced by ESG. So if you are looking at, let's say, housekeeping department, What could be the ESG goals for them? Well, they could look at reducing waste. They could look at reducing plastics. They could look at reducing the chemicals that they consume. For an HR department, this could be staff welfare. How do we reduce needle stick injuries? How do we make sure that we have staff welfare measures that are there? And it could go up to the board, and the board could be looking at things like how transparent are we? What are some of the risks that we have identified? What are the risk reduction strategies that we have? And so on and so forth. So, the idea being that the governance aspect not only has oversight over the program, but also has a responsibility towards the attainment of ESG goals for an organization themselves. Moving to D. D is very important. This is data and tracking ESG metrics that you may take out from GRI, you may take out from your own organization's practices, you may take out of JCI's GHI chapter, or you may take out from NABH's checklist that has just come out. Any one which you do, there has to be some data which backs it. So how do we measure that data? And why am I laying so much emphasis on data? Because once you start measuring this, you will find that there are lots of discrepancies, even on small things like the units that you measure with. Are you measuring your water consumption in kiloliters or in liters? Are you looking at energy consumptions in kWh or WH? All of these, right from that level down to your performance management, means that data is going to be driving your ESG performance. And frankly, without good data, like I said earlier, you will not be able to model your organization in terms of the impacts that you've created. And then to achieve the outcomes, you need to have programs and projects on energy efficiency, water, waste, staff, governance, all of these programs that you need to create along with various stakeholders to then make sure that your ESG is being implemented. Because, mind you, for example, let's take a metric like reducing energy consumption. That may be a metric that you've taken from GRI. But end of the day, you will need to have a project or a program that works towards your entire organization reducing your electricity consumption. It could be awareness to switch off lights. It could be automation where a building management system is automatically cutting lights. It could be moving to renewables. There are multiple things that you will have to do to meet that metric, and data will then be recorded on it. So that is how you need to look at the GDP model when you're looking at aligning your performance with your objectives. Like I said, this really governance will help drive your mission and accountability so that we are on track. Data will make sure that all your outcomes have relevant KPIs, and then there is data that is backing them. And programs will ensure that you're actually implementing things on the ground to make this a reality. And this is where the GDP model comes together with ESG. So with a good GDP model that you will have, clear roles and responsibilities which are earmarked for people, and people are then accountable for it. There are people then responsible for ESG. So there is clear leadership alignment. There is data infrastructure to then capture and analyze the various metrics that you want to report on. There will be projects that you will be then implementing, whether it's at the ward level, department level, or organization level, that you will then work towards. You will then also ensure with that data, and with those metrics on ESG, that there is a feedback and a self-perpetuating loop of learning that then starts. And then when you use things like GRI, you will then be reporting on those frameworks, and then there will be better credibility in terms of how you're reporting on those data. And of course, all of this will also foster cross collaboration, teamwork, because without that, it will not really happen. So, when you do good governance mechanisms, you need to then look at what are some of the challenges that can come. If you have good governance, again, where there are clear roles and responsibilities, there's a good strategic focus. Then what you have to do. But if you don't have good governance mechanisms, if there are potential gaps, that can prove to be a weakness of your ESG program, and then really impact your performance. At the same time, governance can also help bring people in. Those people who are not part of the program, you can bring into some sort of mechanism, some oversight committee, some environment committee, or a social committee. You could make sure that people are co-opted in as an opportunity to engage people more. But mind you, if you don't have a good governance program, the regulatory risks really increase. When we look at the G part of the GDP, what does it also entail? It also entails ethical and transparent hospital leadership. And again, this is not only for the top, but it is also for all levels of the organization. So, risk, compliance, transparent decision making. This is very, very important in an organization when you're creating, an ESG program, because this will help improve patient safety, ensure you have regulatory compliance, but also at the same time help build trust, both internally, but also with regulators, with other stakeholders over and beyond. When we look at the data part of it, as I said, good, complete, and accurate data will help this be more like an audit style, readiness for anybody to come and see that data. So if you have good data collection and you have a good, collection mechanics and a good archiving, system, then anybody can come and check your data. If it is backed by good evidence, you can say, this is how I've collected this data. When I implemented this program, this is how it has been able to improve on the performance. And what is it that you could really capture within this? There are various things that one could capture. This could include things like environmental metrics, energy usage, emissions, social indicators like staff turnover and patient satisfaction, and then compliance in terms of the governance. And how can you really strengthen this data collection? There are multiple tools that are now available. I would actually strongly encourage the organizations to move beyond just Excel. That is a good place to start your data collection with, but then move towards automation, or usage of softwares that can automate collection, that can help in better scientific collection, so that these databases that you create have certain degree of reporting readiness and rigor to it. And when you have good, ESG tracking, you could also have good dashboards. And when you have good dashboards, you can improve your ESG performance. In fact, one study in the United States pointed out at nearly a 100% improvement in ESG performance for organizations that used evidence-based dashboards, meaning good data capture that is being then put into dashboards. And this is obvious. Anything you measure will improve, and anything that is measured is then taken more seriously if the data management is good. Again, as I spoke at the start in my opening remarks, data integrity and transparency is also becoming very important as we move towards, in India specifically, towards the new DPDP Act. The Digital Data Protection, Personal Data Protection Act is now enforced in the country. And this means that the onus on making sure that the data that we capture, data that we use, and the data that we report on is of the highest quality and standard, because otherwise you could have regulatory action coming against you. So that's why I'm harping on the fact that data is becoming important, not just patient and clinical data, but even non-clinical data, which may not be personal data. But if you are reporting on your hospital's performance on that data, it becomes very important that there are some protocolized approach towards both capture, but also validation of it. Like I said, good ESG programs have proven to have impacts across the board. Cost savings is one, emissions is another. But think about it, 20 to 30% of savings is no small number when you look at the impact that it can have on operational performance, on financial metrics, and reducing your carbon footprint. So what are some of the programs that you could look at beyond just the emissions? Water conservation and waste programs are proven to be highly effective, and these are something that you could probably look at beyond compliance. So we know that biomedical waste management is something that we have to do by law, but there are other programs around waste that you could also do. Speaking of water conservation, very simple fixes like low flow fixtures and recycling systems help increase water usage and efficiency, and they can help reduce operational costs. Similarly, reusing and recycling initiatives of the water that is used can lead to reduction of your water consumption, but also possible for waste. And waste segregation is something that we do, but for biomedical waste, while we may not be able to do a whole lot, there is a opportunity to reduce the amount of biomedical waste that we generate, and that is possible through actually capturing the amount of waste that is generated for each occupied bed. That's one metric that you could use. And the other is on hazardous waste. We know that hospitals generate enormous amount of hazardous waste, and how do we build practices for staff safety and make sure that staff, while handling these hazardous items, are not jeopardized, their health is not jeopardized. Along with this, another very important aspect of S is staff training and their well-being. And this includes having training sessions on ESG, building awareness and engagement so that staff is also attuned towards ESG practices. Similarly, having welfare programs which looks at mental health, work-life balance, looking at the root causes of why there is high turnover in your workforce, whether it is things that you could modify or there are market forces, whatever it may be. What is it that organizations can do to improve the wellness and welfare of its employees is something that we need to look at. And lastly, occupational safety. We work in very for a lack of a better word, very dangerous environments. Hospitals are not, areas which are safe because there are chemicals, there is risk of infection, there are so many other types of risks that are there in a hospital. It is a place that we need to work towards making it safer for our staff. And occupational safety could be making sure that when a engineer is using a ladder, they are wearing a helmet or a hard hat. To when a staff working with sharps is given the resources and training to make sure that they don't actually injure themselves while handling sharps. So those are all aspects of occupational safety that we need to work in. And this is where a good quality program also helps, where we take back from them, some of those measures and build into our own ESG practices. Cybersecurity is one aspect I want to just touch upon. We know that as part of ESG data governance, we need to look at cybersecurity very critically because we handle so much sensitive patient data, operational data, proprietary data, and if this data is leaked, not only will it have an impact on your reputation, but there could be also other impacts that this could have on staff safety, on patient safety, and so on. And this can also lead to a financial penalties that could come from the regulator, loss of shareholder stakeholder trust, and service disruptions, because we've seen cyber attacks are on the increase. And a good ESG program also needs to look at cybersecurity. Now, you would say I'm not a cybersecurity expert. I don't know anything about how do I make sure that my data is safe and secure. The idea is, as a good professional who may be managing or starting to look at ESG reporting and management, you then need to work with various stakeholders, internal stakeholders, and the IT department becomes a very important stakeholder. So again, when we are looking at ESG, this encompasses every part of the organization, and cybersecurity is increasingly becoming one major aspect along with the DPDP Act, as I told you. So again, this is something that you will need to work towards. And for staff, we would need to have what is called cyber hygiene training to reduce that cybersecurity risk. We know that most breaches happen because of human error. The one link that we clicked, one information that we gave on the phone, one password that we shared. These are all types of risks that we can reduce as part of a good ESG program, working with our IT teams and professionals. How do we make staff more aware to reduce that risk and reduce those vulnerabilities, and then also have good, robust compliance mechanisms, which could then help automate many of those risks that are there. What are some of those measures? They could include things like encryption, where data, even if it is stolen or hacked into can make no sense to others because it is encrypted. And it could also mean incident response plans. If there is a breach, how do we respond to it? Then there are other platforms that one could use, things like HIPAA compliance, and also there are various compliances within India that you could do to make sure that access and compliance to your data is as secure as possible. And then strongly encourage your IT teams to undergo certification for their data management practices. There are ISO standards also on data management, which are important, but also build it as part of an audit exercise that you do for the hospital. So now, moving to the last part of my presentation, what are some of the metrics that you could look at? This is not an exhaustive list. This is just an indicative list that I'm putting out there. First and foremost, to measure the relevance, materiality, and measurability, and certain standards is going to be important. What metrics should I take? For that, look at these four approaches. One is, what is the relevance to my operations? What type of clinical activities do you have? What type of workforce do you have? What type of procedures do you carry out? Which environment do you operate in? All of these will be very important when you select indicators that get tied into your hospital activity. It's good to get as specific as possible. If you are a single specialty clinic or hospital, then try to look at metrics which make sense for your type of setting rather than just going for generic reporting. The other very important thing is materiality. Materiality means what is important to whom. So, materiality to stakeholders means prioritize those metrics which are important for a certain stakeholder type. So, for example, for a patient, infection post surgery may be an important metric, or the environmental safety might be important to a particular stakeholder like a regulator. So you need to work towards creating metrics which have a material nature to them, which means that they're important to a particular stakeholders. So first look at all your stakeholders, map who are all your stakeholders, both internal and external, and then identify what are material topics for them. How do we do that? You could do that by having interviews. You could do that by reaching out to a select group of your stakeholder community, and then taking the relevant GRI standards and saying that I chose these because these are material. Next, please make sure that what you choose is measurable. Many a times, we choose metrics which sound very good on paper, but we may not have the ability, the organizational maturity, the resources and requirements to actually measure that data. And once measured, we need, going back to my earlier point on data governance, we have to make sure that there is consistent collection of that data, there is reproducibility of that data, there is an audit trail that you have. So, for example, if you are saying that this is my water consumed per month, it has a bill attached by the utility company that actually quantifies and matches with the data that you're reporting on. So that measurability needs to have certain data ownership. It needs to have calculation methods. All of those things are going to be important. Lastly, like I've been saying, laying a lot of emphasis on is that you must align with global standards, because this is important when we look at any good ESG program. So again, I won't spend too much time on this. I'm sure a lot of you are well aware of this. Data analysis, benchmarking, update the metrics, and implement them for a good, successful program. Again, align them with various standards, GRI, SASB, IFRS. I've gone in detail on these. Again, I would strongly request you to look at those. Just some indicative data, and then I'll metrics, and then I'll stop. For energy, you could look at total energy in kilowatt hours, the greenhouse gas emissions that you have. Please join the GGHH network. We have very good data, tools to measure greenhouse gas emissions and total energy that you can download for free once you're a member. For water, you could look at water consumed and the percentage of waste recycled. This could be in liters and kiloliters. Similarly, for procurement, you could look at other criteria. So there are multiple criteria, like I said, available on GRI that you could do. Typically, it's good to start with 2025 metrics, which cover all aspects. Social could be on, patient, staff, workforce diversity, training hours that you've had, community engagement, and so on. And similarly, on governance, you could have on board diversity, on the amount of compliance, or you could have on non-compliance reporting, where you've not been able to meet the specific standard, and then reporting on data breaches on cybersecurity. So, in conclusion, you need to have a credible foundation for your ESG program, which should be framework led. Use the GDP approach when you're creating this program, and make sure that you build resiliency into everything that you do. And with that, I will just stop and thank both Dr. Sunil and Dr. Shweta for this opportunity, for presenting here, and handing it back to Sunil sir for any questions or follow-ups. Thank you.
Thank you so thank you so much, Dr. Karan, for sharing your valuable insight. I think we have few questions in the Q&A box. So the same participant has asked 4 questions. I'll just take up the questions one by one. Uh, the first question is that with the emergence of IFRS S1 and S2, which focus on financial materiality for investors, how should hospitals balance this with the GRI standards that emphasize broader societal and environmental impacts? So which of these is more user-friendly for a hospital?
Sir, GRI standards, I would say just go with GRI to begin with. S1, S2 are in, for very advanced organizations, and they are not compulsory. So I would say just for the time being, GRI is the benchmark. As your organization matures, you could look at S1, S2, but without GRI, S1, S2 don't have too much meaning.
Yeah. The second question by the same participant is, why does the public health sector struggle more with consistent ESG reporting as compared to the private sector? Is it primarily because of the funding, or are there any deeper structural and data governance hurdles?
I think, sir, data is one challenge. Uniformity of data management is one. The other is sometimes the type of approach is too high end for, let's say, the setting that you may be in. I would say start small. Like I said, it need not be that you report on all standards. Start on 4, 5, 10, 15. It need not be the complete menu of GRI. Starting small helps. But I would also point out that a lot of public health institutions, especially in India, many state governments are working very, vigorously on sustainability reporting and standards. So I think it is also, the will and leadership, apart from some of the other resource challenges that are there. The answer to that would be start small. Whatever you can measure, whatever you can improve, at least that is a good start point.
Good. And the third question is the most significant risks for a healthcare organization that either fails to report or integrate ESG poorly. So how do we manage this?
We For data privacy, it's very clear we don't need to report on patient safety outcomes, patient personal data on any of those metrics. What we need to do is to choose metrics which are GRI aligned, but protect patient safety and their personal information. So we need to firewall the personal information of all our staff, of all our patients. But when you're reporting, please make sure that you align yourself with GRI. And again, it is up to you how many of those GRI standards you want to use. You could start with small, and you could then write in your report, this is aligned with GRI standards. When you are in a position to report on all GRI standards, then you say in compliance with GRI standards, both are acceptable.
Great. And the last question by the same participant, I think I should thank this participant, Shepo Mokhadi, who has asked a very relevant and good number of questions. The last question by her is that does a hospital need a dedicated ESG expert with specific qualifications, any core competencies required to begin this reporting, and or can existing clinical administrative leadership manage this?
I have, Shapo, I've been I've been running hospitals all my career. I'm not an ESG, was an ESG expert, but the good part is
Yeah.
that what ESG requires is people who understand hospitals or healthcare institutions from ground up. Only those who have run institutions or manage hospitals or work in quality or operations or any other clinical field can build a good ESG practice. Once you know the principles of ESG, that is all that you need. So you don't really need an expert, but you do need somebody whose assigned job is also sustainability or is core sustainability, because without that then the program is very scattered. So you need dedicated person but need not be an ESG expert, so to say.
Yeah. So it is by virtue of your experience and training, I think we can build up a team actually, and someone has to
Absolutely.
be ESG champion. We must,
Absolutely.
yeah, great. So it's very well on time, Karan. Thank you so much. And as we have come to close of today's
Sir,
session,
there is one more
yeah,
question, sir.
acha, one
In
question.
the chat, it
Okay, maybe I missed it in the
yeah,
chat.
I'll just read that out. So many hospitals are under reimbursement pressure while ESG expectations. How do we see operational discipline and governance evolving together in Indian hospitals? I don't think, Azim, that's a good question. I don't think they are mutually exclusive. A good ESG program will build operational efficiencies or at least enhance them. So, and also governance will improve when we look at, a good ESG program. My sense is that ESG, yes, when you build the program is resource intensive, needs people, needs teams. But once it becomes part of like quality, becomes part of everybody's DNA or things to do,
Mm,
then it is part of operational excellence. It is not separate from it.
all right. So any more questions? I don't see any more questions here.
Yeah,
Uh,
and Dr. Sunil, I would just like to pitch in for one quick comment. And first of all, Dr. Karan, thank you very much. This is always very insightful. Your expertise in this particular domain is amazing. And every time, this is the second webinar which we have organized from the region north under the HELP platform. Leadership that we want to make the people, the healthcare community aware about the role of ESG and the importance of ESG. And also, I would just like to add that the as an accreditation, bodies are also encouraging just JCI and NABH. Our NABH also has stressed upon in the ROM chapter, and I was actually quickly referring to the standard, the ROM 3, which talks about this whole standard is a new standard which talks about the sustainability, the ESG component, and all the
Yes.
elements which you have mentioned is part of that standard compliant with the sixth edition. So probably it's also a responsibility being an accredited organization. How do we contribute? How do we ensure that we are compliant to this particular standard with respect
Yes.
to it? So this is very a big step by the accrediting bodies have
Yes.
taken in and they have incorporated in their standards. And again it's the baby steps, like we started with the ABC of ESG, and I think so we have taken a one big leap in how to develop that program, which you have really outlined it very well. Hope all the participants who are there, they can go and actually visit our website, the help platform, and it's a free membership. It's the resources are available as you become the member, so healthcare community can get benefited by this particular health network and the resources which are available. So this recording will also will be available there. Thank you once again. Thank you, Dr. Sunil, for moderating this session. And over to you. I'll for your closing remarks.
No, no, thank you. I would like to add one thing here. As Shweta also mentioned about the NABH standard, now ISQA has mandated
Yes.
all the accreditation bodies that ESG program or sustainability should be part of their, there has to be one chapter on
Yes.
sustainability. It is not just one standard.
Yes.
I think slowly it's evolving, and it will be an integral part of the standards now. And I would really sincerely thank our speaker, Mr. Karan Thakur,
Oh, thank
for
you, sir.
sharing his
Thank you.
valuable insights on how hospitals can build meaningful and actionable ESG sustainability programs. So this discussion today highlighted various aspects of ESG, including the healthcare sustainability risk. He very nicely, elaborated on the sustainability risk, the implementation strategy at the hospitals, how we can significantly reduce the operational and energy cost up to 25% and 30% with successful implementation of this ESG program, and how you can align your ESG program to GRI guidelines and SDG goals. And this ESG metrics, he mentioned about implementing the ESG metrics, monitoring, measuring, and improving in various departments. He also mentioned about the data security, cyber security in ESG reporting and management, the occupational safety, staff training, well-being, how important it is. And finally, ESG should be part of the management review and the boardroom discussions. And how important is the governance in engaging people in the organization. So finally, sustainability in healthcare is no longer optional. It is essential for building resilient health systems that protect both human health and the health of our planet. So I would like to thank Dr. Shweta Prabhakar, the regional lead, North, and also to thank Nikita Katuria from Health Secretariat for coordinating this webinar and contributing to this important conversation. So this is the second webinar, as mentioned by Shweta, that in series under the platform of health. And before we conclude, I would also like to invite all of you to participate in the International Health and Environment Leadership Conference, which will be held on 20th June 2026. That is on June 2026 at Yashoda Hospital, High Tech City. And this conference will bring together all the stakeholders to further advance the agenda of environmentally responsible healthcare. So I encourage all of you to register through the website of the HELP platform and be part of this important global event. Thank you once again for joining us today. I think we are well on time, very good time management. Thank you each and everybody who has really participated and contributed. And I look forward to seeing many of you at the conference in Hyderabad. So have a wonderful evening. Thank you so much.
Thank you. Thank you, sir. Thank you, everyone.
Thanks a lot.
Thank you, everyone. Thank you.
Yeah, bye.
Thank you. Thank you. Bye.